Welcome to the Mama's Fit podcast. In this episode, we're going to be talking about what is a doula? What are they not? How do you become a doula if that's something that you're interested in doing? We're going to talk about how I became a doula and different ways that you can become one if you're interested, what to expect with like a doula training, what you should be looking for in a doula that you're hiring, and what does a doula do or not do? Are they just a birth wizard? I don't know. So let's break it down in this episode. Welcome to the Mama's Fit podcast. My name is Gina. I'm a perinatal fitness trainer and birth doula.
And I'm Roxanne, a certified nurse midwife.
And this is the Mama's Fit podcast, where we empower you on your pregnancy, birth, and postpartum journey.
Our podcast shares how to move throughout your pregnancy to stay strong and comfortable because pain is not a requirement of pregnancy. Understand the science of birth and approach recovery after birth.
We share our personal experience navigating motherhood and our professional expertise as birth workers and fitness professionals.
Our goal is to help you feel confident as you navigate the perinatal timeframe for an empowering pregnancy, positive birth, and postpartum recovery.
We are glad to have you with us on this journey and that you have chosen us to support you. Welcome to the podcast, our podcast that we both have.
The Mama's Fit
Mama's Fit podcast. So I am a birth doula. I did do a postpartum doula training, but I did one postpartum doula thing and I did not love it. I did not love being a postpartum doula, but other people do. So we can briefly touch on what a postpartum doula is because there's a lot of different types of doulas out there, but we're going to really focus on birth doula in this episode. Roxanne is not a doula.
I'm not a doula.
She is a midwife. I am not a midwife. I'm a doula.
They're
and
two
different
separate
from
things.
each other.
And I think that's a common question of should I hire a midwife or a doula? Or both.
Or both. They're not the same thing. So a doula is a non-medical birth buddy. So they're like a labor coach, a birth wizard, but they are not medical. So they should not be diagnosing you. They shouldn't be doing any of your medical vitals or your stats or anything like that. So they're not taking your blood pressure. They're not doing a fetal heart rate tracing on your baby. They're not checking your cervix. They are really a non-medical support person, but they can provide continuous labor support, which is really different from your medical team. So typically with your labor nurse, your midwife, or your provider, they will have multiple patients that they are kind of working with. Now, a labor nurse, I think, should only have up to two patients. Sometimes you may be their only patient, but your midwife may be the midwife for all of the patients from that clinic that are in labor at the same time. So it could be multiple patients. Usually, in a hospital setting, the nurse and the midwife or the medical provider does not just sit in your room the whole time. They may be in there a little bit more depending on your needs, but generally they will kind of come in, check on you, do some stuff, and then they leave to go check on the other patients as well. But a birth doula is someone that you hire, so they're typically independently hired by you, and they provide continuous labor support. So they're with you and whenever you tell them to join you, and then they stay with you until a certain time frame or until your baby's born, depending on whatever the contract was that you guys had. And the difference between being able to provide this continuous labor support versus more of this intermittent support, the medical team is still always there, but they may not be in the room with you, is there are subtle things that I can see as a doula to provide you support immediately versus the labor nurse waiting to see that something's going on, or maybe there's a certain time frame that they have to come in. And so I can just give a little bit different type of support. The other thing is that I provide a different type of support as well. And so my focus is not what is your baby's heart rate, what medication do you need to be given, the overall health of you and your baby. My focus is more of your emotional support, your physical support. So helping with labor positions, helping with comfort measures, helping you understand what is going on by helping you know what questions to ask based on the information that I know about birth in general. So I'm not a medical support person, but I know what Pitocin is, and I know what these different birth interventions are, and I know you as the person that I'm supporting, and so I can help you figure out what questions you need to ask. So my role as a doula is not to tell you this is what's happening with you medically, and this is what you should do. My role as a doula is to help you understand how to communicate with your medical team to better understand what is going on. So for example, if there's like something happening during your labor that maybe there needs to be an intervention, and I know that you personally do not want certain types of interventions, or you would like to limit certain types of interventions, whenever like the midwife or the OB or the nurse comes in and they're talking to you about it, I can help you come up with questions. So if you're feeling really concerned about X, Y, and Z, I can kind of ask you or remind you of some questions that you could ask so that you can get the information from your medical team, which I think is something that most folks don't think about when they come with a doula. They think like labor positions, comfort measures, or they think a doula is going to make decisions for me, which is not what I'm there for. I'm there to help you gather information so that you can make a decision. But I want you to be able to make a decision with your whole team, not just me, not just your provider making decisions for you. I want you to be able to make a decision with the whole team. How have you seen that aspect of a doula be really beneficial versus like not great as like a midwife or as a labor nurse?
So birth doulas, like they are part of the team, and I think that it depends on where you're kind of like supporting the birth on how integrated you are into the team. Because in some places that I've worked, they like do not love a doula, and they feel that you are
Undermining.
yes, like you're just trying to like get them to like not do the things that we want them to do, quote unquote. Obviously not my viewpoint. But other places that I've worked, like I love birth doula because they are going to help me like support the patient in a way that I can, especially if I had more than one patient. Because I was the labor nurse that was, if I only had one patient, I was in that room a lot more, like providing the support that they wanted, especially if they didn't want an epidural, or we were waiting until like they were more active to get their epidural and putting them into different positions. But if a doula's there, like they would do all of that. And then I can just sit down and focus on like other things. Because as the labor nurse and now as the midwife, my focus is, yes, on the emotional aspect of it, which is also why like the type of birth that I am hoping to support is out of hospital birth, community birth, because you are more into the emotional side. You have more time for that portion. Whereas when I was in the hospital, like there's not always the time for the emotional support and like the level that I wanted to do. So when someone would have a doula, I knew that they would have that support, and I didn't have to like find a way to like squeeze it into my shift. If I had more than one patient, it's hard to kind of do that for two patients. In like one birth that I was in, one day I had two patients, both going unmedicated. One had a doula and the other one did not have a doula. So it was nice that I had a doula because she was there supporting her through her labor, and I could just watch the baby and then focus on providing emotional support for the other one. So in that aspect, I do love a doula to like incorporate them into providing and supporting the patients. But the other, like when the other doula was like, oh, she now is looking more active and I think she's going to start pushing soon, we would respect that, like her observations, because then that tells us like, oh, we should make sure that everything is ready to like have a baby and like be close by, because she has been in these rooms for so many babies. And like you, same thing. Like if you were like, oh, she's going to start, like she's looking like she's shifting, she's probably going to start pushing soon, we would trust your observation. And then also incorporate you into like the decision making. So now like at the birth center, when we see doulas, like we are in there more often, but we still value their input into like what are they like seeing that we're not seeing. Because sometimes like the medical, you could get like kind of like tunnel vision. And so the whole team, including the doula, is helpful to be like, hey, like this is what we were wanting to do, or like that she really wanted to do this in her birth. And so then we can like get out of our tunnel and like incorporate all of those things.
So one of the things that I've noticed with that, and I would be curious like what the total number of hours that I've spent in a labor room versus like what you have spent in a labor room, even though you supported like way more births than I have. Like I would be curious what that like hour comparison was, not to be like, I've done it more than you, but like just the amount of time that I've actually spent in the room watching somebody labor, I think has a lot of value to it. And so sometimes what'll happen is I will see that this person is having contractions at this rate and that their intensity is increasing. And I will see all of these like subtle shifts that labor is progressing. But sometimes if like the nurse is kind of going back and forth between rooms, or they're not spending a lot of time in the room because I'm there, like they don't need to spend time in the room. Like it's too many people at that point, is they may not notice these subtle changes. And because they weren't asking me for the information to give themselves a full picture, they start doing things without knowing that labor was progressing. So they might come in and be like, oh, the monitor is still showing that the contractions are the same spacing, even though the monitor doesn't show how strong they are necessarily. I'm going to continue to increase the Pitocin because the contractions look the same to me on the monitors. But if they had asked me, or they like sat in the room for a few minutes to watch the patient, they would have seen, oh, these contractions are more intense now. Maybe I don't need to increase it right now. Or maybe I do. I don't know. So if we can gather information together, it can really help the person that's in labor, I think, have a better experience too, as opposed to feeling like we're on different teams, like that they don't want to take like information that I'm giving them versus the other. I've had it in other hospitals that were definitely not on team doula, because it is sometimes a little bit of like, if there's a doula in the room, then people start asking too many questions, and then I have to answer all these questions, which is fortunately not every hospital, but it becomes like an extra step where like, okay, well now I have to like explain stuff to this person, and they're not like, my authority should be enough for them. And I could see how that can be frustrating for some folks, where the monitor wasn't picking up contractions. And they're like, oh, well, we have to keep increasing this because there's no contractions. And I'm like, well, she's having them. Like, I could show you the timer. Like, I can, like, if you just stand here for a few minutes, you'll see that her contractions are like 3 minutes long because the Pitocin's too high or whatever reason. I don't know. You're the medical person. You tell me why she's having 4-minute long contractions. And they would just keep increasing it. And then the baby did not do very well. Now, whether or not those were correlated, I don't know. I'm not a medical person, but I can make some assumptions.
Oh, well, Gina changed the tone there.
But in those situations, like I was not able to be a part of the team to provide the information that I'm seeing. And in those situations, I think it hurts the patient and the person that is in labor. Yeah, so I think we can all gather information.
I think
together.
It's just important to know that, like, yes, a doula is not a medical professional, but their opinions are still valid and important, and integrating them into the team has been shown to be very beneficial for birth outcomes, not just like birth outcomes of like vaginal birth, but like a positive birth experience as well. I mean, this is been studied, continuous labor support, whether a doula or somebody else, because a doula doesn't always have to be like a certified doula through like organizations. It can be like a family member or a friend who is going to continuously support you in that way during labor. And this has been shown to be so beneficial for decreasing the number of interventions that are used during labor, decreasing the rate of C-sections. So like all of these things. But the biggest thing is that people are leaving birth feeling empowered and confident and having positive birth experiences by all of this continuous labor support, whether with a doula or a family member. And that person should be like in the discussion and be included in like the decision making, not necessarily the decision making, but that conversation. And they shouldn't be like excluded. Like if someone had their mom at the birth as their continuous labor support, you wouldn't exclude them from the conversation. And so like a birth doula should also not be excluded. And I don't know of, like, I have not met a doula personally yet that is like very confrontational towards
which I think is the
medical
other
provider,
side of this conversation.
which is also important because I think that there are doulas out there, and I thankfully have not met them, who are very much like, oh, they're out to sabotage your birth and we shouldn't trust anything that they recommend. And then like their patient will develop something like that they do maybe need an intervention, or like that we are recommending something, but because their doula had told them, oh, Pitocin is the worst thing that you'll ever experience and you should never get Pitocin or it'll ruin your birth, then this person now has all of this fear because maybe they did develop something in their pregnancy and induction is recommended and they want to move forward with that induction, but they're like, I will do everything but Pitocin. And then it's like, we will, at some point, we need to use Pitocin potentially for your labor induction. And so then it ties like the medical team's hands. And so that's where I can see why medical providers, if they'll have like experience with those types of doulas who are very much like anti-medicine, anti-doctor, like that does get hard as a medical professional. But I think had they been included in the conversation and been a part of a team where from medical providers, I don't think that they would have the same opinion.
So I definitely agree that there are doulas out there, which I think it's interesting that you've never actually experienced it.
Yeah, I've had really great experiences
But
with
I think
every doula.
it might reflect as you, as a medical person as well, that they maybe haven't had to be hostile towards you. But I do know that there are doulas out there, because we'll have people that'll message us that are like, this really weird thing happened with my doula. Like, I don't know how to feel about it. And I've interacted with some other doulas where I'm like, I'm not sure that you're like judgment free. So you want, if you're looking to hire a doula, you want to make sure that their vision of your birth kind of aligns with yours as well, would be like my first step. Because I know when I first started as a doula, like I had only had one baby at that point, and I was still holding on to a lot of trauma from my first birth. And I'm sure this is similar for other people that enter fields to be helpful, is that you don't want other people to have that trauma too. And there are certain things for me that I associated with that trauma, and so I was more hesitant and scared of it, and I would kind of project that onto some of my earlier clients until I like matured as a doula and was like, okay, there are times when these things are appropriate for you. And maybe some of that came from like my doula training and the background that I came from as well, was kind of this distrust of the medical system. Fortunately, I have matured past that like pretty quickly, but there are some doulas out there that are very much it's us versus them, and they project that onto their clients, which then makes them very fearful. So wherever you are choosing to give birth, if you feel comfortable with that provider and that provider helps you feel good and you feel comfortable with the decision to give birth wherever you choose, your doula should support you in that, whether or not they think it's a good location or not. Because for me, like there are some providers and some birth locations that like I personally would not like to go to. But I respect that my clients may have different preferences and that's okay. People can still go and have really wonderful experiences in places that I would not like to be. And that's okay. And so if you have a doula that is very anti other people on the team, like the only person you should be talking to is me, like only my opinion on this matters, and they're very like anti other people on the team, and they make you feel more stressed out and make you not trust people that you have chosen to support you, that's a red flag to me. Now, there's a difference between you feel uneasy about the provider that you've chosen and they're helping you find a different option.
Yeah.
Like you want something different. Like this is from you. Like, you know what? Actually, I don't feel really comfortable with my provider. This is where like a doula can be helpful to gather information and help you find a different provider. It's different when you feel comfortable with your provider and they are trying to create this distrust. And sometimes you can kind of tell with like the social media content that they post. If you genuinely feel like if you told them that you wanted to do something different, that they would judge you, that they're not a good fit for you. They're not a good fit for you. Because there are some people that have really passionate about certain types of interventions or certain like medications. And if you feel like if I told them I was going to do the opposite of that, like if you told them I'm going to get an epidural, that they would judge you, they're not a good doula. They're not a good fit for you.
Yeah.
Like you need to find somebody else. I don't think that there is as many like that out there. I don't know. I don't have a number.
Yeah. I mean, I haven't met one. So.
I've had to sign stuff that says like I will not be a problem in hospitals. Like,
but there are hospitals that don't allow doulas.
Yeah, so there are obviously doulas out there that have caused problems for other people that are encouraging their clients to not take medical advice, which is a problem. So whoever you have chosen to be on your team, and this is for the provider that you choose, the chiropractor you choose, the PT, the doula, whoever you choose to be on your team, should understand that they are a part of a team and they should not be trying to isolate you from other members on that team, or they should not be trying to create distrust with other people on your team. And so this doesn't apply just to the doula. This also applies to your provider, to your chiro, whoever you're seeing. If any of them make you feel uneasy about other team members, they should not be on your team anymore, and you should find somebody else. Other things that just as like a recap on like what a doula does for you. One, they provide continuous labor support. So they're with you the whole time, doing their thing. With that continuous labor support, they're providing physical support with like comfort measures, of recommending labor positions. They're guiding your partner to know what to do as well. They don't replace your partner by any means. They're providing emotional support, so they're helping you to feel safe and supported within your environment. They can provide advocacy, so they can help you gather information to then make decisions, and it kind of reminds you of different stuff as well, because sometimes it's hard to know. Like, I'll like come to a birth and I'll know that this like mom wants to have like complete freedom of movement, and she's got like an IV pole with just fluids. And I'm like, oh, did you want to be hooked up to fluids? Like, was that a request of yours? Like, because I'm not going to be like, ew, why do you have this pole on you? Like, I'll like first kind of confirm, like, is this what you wanted? And she's like, oh, no, they just did it. And I didn't think anything of it. I'm like, do you want to be attached to the pole? Do you feel like you need fluids? She's like, no. And I'm like, oh, but we can ask, is to see if they can take it off. Like, there might be a reason why. Like, maybe they didn't explain to you why you needed it. So we could ask about it. She's like, oh, yeah, I would totally love to not have this thing attached to me. And then it was like, oh, yeah, it was just routine. Like, we just hook people up to it. And then she would, oh, I didn't know that I could do that. And so that's something like a doula can be helpful for. So you can know, like, what can I not do, or what can I do?
I think it
not
is
that
important
it's law,
to know that like, you can do whatever the hell you want.
Yeah, you can do whatever you want.
And that even though you're in the hospital and you're pregnant, doesn't mean that they get to decide what happens to your body. But having a doula there to remind you of that you get to decide what happens to your body is really beneficial.
Without being hostile about it. Like, so I don't call the nurse in and go, hey, mother
disconnect your RP. No.
I will say that there was only one time in my whole doula career that I felt like I was very hostile towards a nurse, which I'm very proud of, because there's definitely other moments where like hostility could have been like justified. However, I don't want to bring that type of energy to I don't want to be the person that causes like tension in the room, where a nurse wanted my client to get in the bed to monitor. This lady is in transition. She's getting ready to push this baby out. And she is like not wanting to sit down, which I don't blame her. I don't want to sit down either at that point in my birth. And the nurse was like, I need you to get in the bed because I need to get a good strip on this baby. And I'm like, I feel like you could just hold it. I'm not a medical person, though. I feel like you could just hold it there. And she said, if you don't get in the bed and your baby dies, that's on you. Or something along those lines. Like she brought up like your baby could die from not being monitored because they weren't being monitored. And I was like, whoa. Do you feel like that was appropriate to say? I feel like you can just hold the monitor against her belly if it's really important for you to get like a good tracing. And then she just kind of like looked at me and I was like, I'll hold it there if you need me to. And then she left after that point because I think she realized that she done fucked up. And then she was super nice the rest of the birth, which was not a very long birth. But I don't want to be the person that brings hostility to the room as a doula. And so you gotta kind of like be mindful with like how we are speaking to other people on the team when we are just kind of bringing up suggestions.
Yeah.
Or do we need to do this in this way?
Yeah.
If we do, let's just explain why, because they're unsure on it. So I can really help to facilitate communication as a doula as well.
Which I think is huge.
Because sometimes we just forget, like, oh, this person doesn't understand what is happening.
The tunnel vision, or like we've just, like as a medical professional, you just have done this literally every day, 14 times a day. And that sometimes like you forget that people don't know what this is. And this isn't a routine thing that happens in other people's day. So it's nice to have that reminder of like, hey, what are you doing?
Yeah. Or, I mean, you have to think about, like, the hierarchy of things as well. Someone may not feel comfortable, like, saying that they don't understand. Like, in a position where they feel like they're maybe, like, inferior or they are subordinate to, like, the provider. And so they may not feel comfortable asking questions sometimes. We are all equals. Everyone, the person that is in charge is the one in labor, actually. Yeah, you're the one in charge. But no, it's having like a doula there can be very helpful to remind people about things, to facilitate that communication. And the last thing that, I mean, there's lots of things that doulas can be helpful for, but one of the last things that we can be really beneficial for is resources and networking, because we typically are like well connected within our areas and we can find things that you need or that you're seeking or that you're looking for. So I'll have folks that'll message us, be like, I want to give birth. I want to give birth. Everybody wants to give birth. Like, I would like a birth location with this. This is my vision for my birth. And I'll be like, okay, that's what you want. These are some of the providers that I would recommend in our area for you. Or, okay, I would not recommend this one, but the other rest are fine if this is what you're looking for in your birth. Because sometimes just having a connection in the community can be really helpful for folks. So if you are trying to figure out something in your area, like I don't know who to see for pelvic PT, or I don't know who to see for this or that, sometimes just working with a doula can help you with that kind of stuff.
They have all
too.
those connections
Yeah.
in your area.
Even if you're not going to hire them, sometimes just asking them the question can be really, they usually will answer you. Like, but you may, maybe hire them if you
If
want,
you like them.
If you want.
Yeah.
So overall, a doula can provide a lot during your birth. They don't replace your partner, but sometimes there is a financial barrier to hiring a doula, which can be sometimes more challenging. Some insurances do cover doulas, or they'll reimburse partially for some. So for us, with like we have military insurance with TRICARE, they will cover a certain portion. I've had other insurances that will cover it, but you might need to be certified through a certain organization to get coverage as an insurance. So for me personally, I have let my certification lapse because a doula certification is made up. So there's no licensing organization. It is just a random person decided that this is my certification for doula. So there's no like big overarching governing body that says what a doula needs to be certified. Each organization kind of has their own thing. But certain organizations have enough like prestige to them to where they have some sort of like contract. I don't know how it works. Certain ones are approved with insurances. And so if you are looking to become a doula, sometimes being certified in those organizations can be helpful. And I don't know what all of them are that are with insurances. I know the one that I certified with originally is, but there are other ones that are, because I think there's a few options. And if you are somebody that wants to have your doula covered, checking with your insurance of what kind of qualifications or certifications they need to have, if they cover it at all, can be really beneficial as well. There are some like scholarship programs out there. Some hospitals will have volunteer doulas that'll work with you. And so there are like different options. Sometimes you can find like a new doula that's like trying to get certified. Sometimes they'll do like discounted services to like try to get their certifications in, but then they don't have as much experience. And so trying to like figure out the financial aspect of hiring a doula can sometimes be challenging. Obviously, like it's easy for me to say, oh, it's totally worth the investment. You should totally do it. But it can still be pretty pricey depending where you are. Some areas, doulas are like thousands of dollars.
Yeah.
Some areas, they're not as expensive.
I think it helps like your birth location could also like sway whether or not you would want a doula. Because in community birth, our birth centers, they do provide a little bit more one-on-one support, but for like home births, like usually they're only going to go to one person's house, but they're probably not going to show up to your house in early labor unless you really need a lot of support. So they may not provide as much continuous labor support with home birth, but in the birth center, they also could have more than one person laboring there. So you may not get one-on-one support, but they may not be as high of a demand if you are giving birth in the community setting versus a hospital, because they may not have anybody to provide continuous labor support in a hospital. But there are like lots of other programs, like nonprofits that will like pay like for a portion of the doula fee, or like all of the other options that Gina listed to make it more affordable. But I do know there are like sometimes like friends and family who love birth and want to and love you and want to support you that will like do certifications or like do the childbirth education courses with you so that they're able to support you as well. Because sometimes having someone other than just your partner can be nice, but also know that if you don't want other people in your labor space and you just want your partner, that's also okay. And like they can be your doula.
I think my controversial opinion on this is that you could give birth without a doula and that you will probably be fine too. I don't think it's like a mandatory like expense that you need to take on if it's gonna like put you in debt or
Don't
like
put it on the
there's
credit
plenty
card.
of ways to learn as much as possible. And I would say at a minimum, finding a provider that you feel like you can truly trust to help guide you during your birth, that like wants to listen to you, that like takes your questions like seriously, is like a really good sign that you're probably going to a birth location that like they're going to be supportive of you. If you're seeing a provider that is like annoyed by your questions and like frustrated that they have to like answer anything, or every time you ask a question they just kind of dismiss it, that would be a red flag to me that if I'm not going to hire a doula, I need to find a different provider, potentially, if you have that option by any means. Some doulas will also do trades where like they'll do like a service trade with you, where like if you can do something that they want, then sometimes you could swap services.
Yeah, I know I need a trade like that.
You know, so it's like you can do, I had one lady that did like nutrition coaching, and like she offered nutrition coaching for me in exchange for doula services.
Obviously, Gina's doing real well with that coaching.
I'm really crushing the nutrition aspect of my life. But there's different options out there. So I would say like finding a doula that has like a price range that works for you. Sometimes newer doulas will have lower rates than more experienced ones. Like figure out if there's like a trade that you can do if this is something that's really important to you. But don't put yourself into debt to hire a doula. I don't think that they're mandatory by any means. I think they can be really helpful, for sure. But at a minimum, choosing a provider that you feel very comfortable talking to would be like my bare minimum. Even if you're going to have a doula, you're going to have a better experience if you have a provider that you feel like you can talk to. So now let's talk kind of on the quicker side. How do you become a doula? You can literally just show up and be a doula. There's no, like I said, there's no licensure involved with it. Like you can just wake up one day and decide, I'm going to be a doula. Now, whether or not clients will hire you, if you just wake up and say, I'm a doula, is like a whole nother scenario. And so this is where getting some sort of certification can be really helpful. And there's a lot of different like doula organizations out there. There's DONA, who like I certified through. There's Pro Doula. I think ICEA has one. So there's so many different like doula agencies out there. And so what I would recommend is if you're just starting out is to find an agency that can be covered by insurance, because this can sometimes be a marketable point for you. And so you just kind of like pick whichever one you want to do based on like what their certification requirements are, like what their continuing education requirements are. Do they have like a membership fee that you need to pay? What do they cover in their doula curriculum, and what is required to become it? And so I'll talk specifically about DONA because that's the one that I personally use, which I think is like Doulas of North America. It's one of the largest organizations and I think one of the oldest ones. I think it's the one that like Penny Simpkins like founded as well. So I know that one's covered by a lot of insurances. And again, it's one of the oldest foundations. So people are like sometimes more familiar. If they know what a doula is, they're like more familiar with DONA. But there's so many out there. You don't have to do DONA by any means. For DONA, there is a birth doula course that you can take. It's like a weekend course. I think it's like 3 or 4 days long, where you just kind of like get word vomited all of the stuff for birth. So you learn what different interventions are. You learn comfort measures. You learn some labor positions. But it's pretty like basic, like ground level stuff. So you are just kind of learning the foundational shit. But with the doula certification, after you take the weekend course, you then have to go through a whole certification process where you have to write an essay, you've got some books to read, and then you have to attend 3 births. Now, they can be paid or they can be free births. And so this is sometimes where you can find someone that has like a little bit of experience, but maybe provides like really low cost services during this certification phase. So during the certification phase, you attend your 3 births, and this is where you start really learning stuff as a doula, because you start getting exposed to different scenarios where an intervention was actually needed. So it's not just Pitocin's bad. It's, actually, I've been in a few situations where this Pitocin was really good. But I've also been in some situations where Pitocin wasn't so good and maybe had adverse outcomes. And so then you start kind of experiencing different things from the perspective as this like doula, but you're not like the medical personnel, but you get to you start learning a lot of different stuff from the perspective of the family, because I'm in the room with them the whole time and they're like, I had a question on that thing. It's like, oh, well, that is something that a family member is going to want to know. So now I know this is an important question to ask when we have the provider in here who maybe didn't know that this was something that people are wondering about after they leave the room. So with the DONA certification, you do those 3. Someone has to sign up on them. So usually it's like the midwife or the OB or nurse signs off on your little sheet, says how you did. They're like 4 stars, 5 stars. This person sucks. Don't ever certify them. Most of the time they're like, they were fine. And then you submit your packet. There is a fee to submit a packet for DONA. I believe there's a fee for all the other ones as well. I'm not 100% sure. And then there was CE requirements. So every 3 years you had to recertify with like a packet where you essentially submit your what courses you've been taking over the years, and then you pay like an annual membership fee. The reason why I let my DONA certification lapse is not because I don't take my doula certification seriously. It's that I didn't find the membership was doing anything for me, and that being certified was bringing me clients because people were just hiring me for me. So I let it lapse because I didn't want to pay the extra $100 a year. However, anybody that wants to use my services with insurance cannot now. So then I refer them to other people, but I'm also not taking as many clients or really any clients now. So my desire to maintain my certification is less important. Other things that we can do after you got your certification is if you're trying to figure out, okay, well, how do I get experience now? Nobody wants to hire a brand new doula. I mean, some people do. One place that you can go to get some more experience is you can work for a doula agency. And so they essentially find the clients for you, and then you usually like kind of tag team births. Or I don't think the pay is as good in most agencies unless you're like a senior doula as if you were like independent. However, you can make $0 independent if you don't have any experience versus like working with an agency. So sometimes I'll recommend that to folks who are brand new to doulaing is to join an agency. And sometimes you get like the mentorship with it. You get the clients and the experience, and you have like other doulas that you can kind of like ask questions to, which can be super beneficial as well. Now, when it comes to the continuing education, because the doula course is like bare minimum, it's like ground floor stuff. You're going to learn the most from like hands-on experience at births. However, you can also take other courses to learn things. And this is where I'm going to toot our horn. Our pelvic mechanics course is pretty good to help you understand the labor positions. Because as a doula, that is literally your main tool to support somebody's labor progress is positioning. Like that is literally why most people hire doulas, is for labor positions and for comfort measures. And so if you are not savvy on how the pelvis moves, you are doing a disservice to your clients. So get savvy on it. The good news is we have a whole course that tells you how to do it. So our pelvic mechanics course for birth professionals and for movement professionals is going to break down in a really in-depth but digestible way on how you can create space in each part of the pelvis and resolve issues in labor with movement as well. So I think that is really, really important for doulas. Like, if you do not understand, it's good for all birth workers. But if literally your only tool in birth is movement and making somebody feel good, and you don't understand movement, you're doing a disservice to your clients. And I will be bold in that statement. So take our pelvic mechanics course. Spitting Babies is another great option that does like movement stuff. That they have like in-person workshops that are all over the place, much more frequent than ours. We have once a month in-person workshops, but they're kind of like on the East Coast near us. We do have some that are in different places, but we do have an online course that you can earn credits for. You can earn 9 nursing credits or 9 ICEA credits for the online course. So there are ways to earn continuing education with us as well. So that is all the stuff on doulas.
Yeah. So just to recap, non-medical professional that provides continuous labor support, both emotionally and physically, with labor comfort techniques, positions, and the
Advocacy,
mental stuff.
They help you find information to make decisions. You make the decision. They don't make them for you. They're a member of the team. If they are a hostile member on that team and making you try to isolate yourself from the other team members, they're not a good doula. But vice versa, they should be included in your team. And so if you're seeing a provider that is like, ew, doulas, maybe not a great provider to be with.
Especially if you have a doula on your team.
Yeah. So every member on your team should be supportive of the other people on your team, and none of them should make you feel like you can't trust other people on your team. If you're hiring a doula, interview them. Interview a bunch of different ones to see who's a good personality fit. I am not a good personality fit for every single person.
What?
I know. It's hard to believe. I am not the best doula for every person. Certain types of people are going to like me better, and certain types of people are going to like other types of doulas a little bit better. Like the personality, like the things that I do, like I don't bring like crystals and stuff to birth, and I don't diffuse a lot of oil. Some people really want that in their birth. I'm not that doula for you. If you want me to meditate with you the whole time, I don't even know how to meditate.
Gina needs to
I
meditate.
need to meditate. So interviewing a bunch of different doulas to see who's a good personality mix or match for you, who has the same vision for your birth as you do, including the vision that may change, just in case. And it's not going to judge you for your plans changing is going to be really, really important. So check out their social media to see kind of what kind of content they're posting, how they're posting that content to get a good feel for their personality. Interview them, interview a few different doulas, and then figuring out like what certain aspects of your doula are really important to you. You can ask them about their training. You can ask them on like what type of education they've done. Are they certified? If they're not certified, like what type of experience do they have? If they are certified, what type of experience do they have? Like if you're looking for a VBAC, finding a doula that's very experienced with VBACs can be really important. Finding doulas that are really experienced with home birth can be really important. So it's going to be an individualized thing for you. So I hope this episode was helpful for you to understand like what is a doula, what is not a doula, how can they be best integrated into your birth team, and then how do you become one if you want to be one. We will be doing a whole episode on how to become a midwife and how to become a labor nurse.
And what are they?
So if you are super interested in those topics, let us know in the comments below so we can prioritize either the labor nurse video first or the midwife video first. And thanks so much for joining us. And so if you would like more support during your pregnancy, your birth, your postpartum, check out our online education courses. We have our childbirth education course, which is a great complement to preparing for your birth. If you can't afford a doula, it can be a really good place to get as much information as possible to support you and your partner during your birth. If you want more movement support, we have our prenatal fitness program, our postpartum fitness programs, and then, of course, our education courses for professionals all on our website at mamastayfit.com. And you can use code STORY10 to get 10% off any of our online offerings, and happy to answer any questions that you have. So thanks so much for tuning in, and we'll see you next time.